Q-drop 4461 displays a picture of a Memorial Day display that had been damaged by a young man, 27-year-old Anthony Burris. Burris, of Henderson, Kentucky, was sentenced to 3 years in jail on one count of first-degree criminal mischief and one count of leaving the scene of an accident. Paying court costs was also a condition of his sentence. Burris was arrested on the same day. May 28, 2016, after allegedly knocking down about 150 memorial crosses and destroying another 20 crosses with his vehicle. Police testified that 55 crosses needed to be replaced following the incident. Why is the story newsworthy? Is it because a meme that started circulating with his image read, 27-year-old Burris decided vets' lives don't matter nor do their memorials in Kentucky? However, the question remains, who started circulating this meme? It has been denied that any official sources contributed to its creation. The assertion was that they knew his motive. Who then created this meme, and why? The question remains, why then did Q include this image in this post? What is he trying to convey? Q-drop 4461 reads, "Only when evil is forced into the light can we defeat it. Only when they can no longer operate in the shadows can people see the truth for themselves. Only when people see the truth for themselves will people understand the true nature of their deception. Seeing is believing. Sometimes you can't tell the public the truth. You must show them. Only then will people find the will to change. It had to be this way. COVID-19 is a PSYOP, a psychological operation." Q-drop 3596 reads, "What advantages might exist when you know the other side's playbook?" The post includes a link to the word trap at the Merriam-Webster Dictionary website. Enjoy the show. Q.
And you're reckless, and you're a nut, and you're some kind of a, and so that's what, right? And you're they'll call you every bad name in the book. Like what they used to call us when we were getting Russiagate right. Those names, they'll call you, the people pushing a conspiracy called the people debunking the Russiagate conspiracy, they called them conspiracy theorists. I saw it with my own eyes, heard it with my own ears. So that's what they'll do to you. So here, and the reason why am I bringing this up? Because I went on the Rolling Stone podcast, Useful Idiots, and I was like, well, we don't know what's the real numbers? What's the real things? What's the real story about COVID? How contagious is it? How many people what are the real numbers?
So if you look at the mortality rate for this, the coronavirus, what is it? And that's the billion or the $1 trillion question right now. So if you look at what that is, outside of Wuhan, China, it was 0.4% with a fatality rate. If you look at the new German data that actually just came out today, it was 0.2%. If you look at the cruise ship data, it was 1%. So you're starting to see some clusters there around 1% or less. And if you look at the flu, what's the mortality rate of the flu in the elderly, which is what this seems to affect more than anything, it can be, again, quite high, about 0.5% to 1%.
That's important, Doc. You brought something up about the Diamond Princess, and it's in one of your articles at Regenix, again, which we'll post for our audience in the show notes at Bongino.com for you to read. You write that the Diamond Princess creates kind of an interesting case study. Closed environment, you know who's on the ship and who's not, obviously. And you talk about that in one of your articles, how that study leads you to believe that some of the mortality rates and the death rates, being reported are maybe exaggerated. Can you just explain what you meant by that with regards to that specific cruise?
Yeah, so the Diamond Princess cruise starts in Wuhan, China. It starts in the epicenter of the coronavirus outbreak. And it goes around, does its thing for a month, and then it docks in Japan. So we know that there were at least one, if not more, infected people on that cruise. Because a week before it docked, finally, there was a guy that got off in Hong Kong, and he tested positive about 6 days later for the coronavirus. So we have 4,000 people in a closed environment with a shared air handling system, with shared spaces. If you've ever been on a cruise, you can't get away from it. You've got stairways with handles, you've got elevators, you've got common areas where everyone eats or circulates through different areas where people eat. And so that gave us this really interesting environment to look at, albeit in a slightly older population, because cruisers tend to be about 10 years older on average than the U.S. population. But it gave us an environment to look at how bad this thing was.
But your point in that, and it's in the article, again, we'll post, folks, is that in this controlled environment, if this was a contagion like we'd never seen before, with an R0, an infection rate off the charts, then more people on that ship, and please correct me if I'm wrong, you're the expert, should have gotten sick. Not saying a lot of people did. It's infectious, no doubt about highly infectious. But again, we're talking about not if it's serious or not, how serious. Am I right there that if it's as dramatic as everybody was making it out to be, more people should have come down ill?
Yeah, there were 17%. So they tested everyone. Unlike everything we're seeing in the media right now, they tested everyone on that ship and everyone who got exposed. And 17% of the people on that ship ended up contracting this after a month. So as you might imagine, if you look at even the flu pandemics, normally if you test everyone in the population in an area that's affected, it's 20 to 40% of the population that will test positive for the flu. Obviously, some people shrug it off, no big deal. Some people get a bit sick, and a few people get really sick. So that was the first thing that set my mind a little bit at ease with this whole thing, was that 17% number, not 50%, not 80% after a month, but 17% in a pressure cooker of a flu spread machine called a cruise ship.
Reported earlier this year, April 7th. The new study, published in the Emerging Infectious Diseases Journal, shifts the R0 or reproduction number for COVID-19 from about 2.2 to about 5.7. With the lower number, only 55% of a population needs to be immune from COVID-19 to stop its spread through herd immunity. Herd immunity refers to enough of a population being immune to a disease that the disease cannot travel through it. But if more people get infected from a single person with COVID-19, then more people need to be protected from the disease to stop it from continuing to spread. With an R0 of 5.7, approximately 82% of the population needs to be immune to reach herd immunity and stop the disease from spreading easily through the population, the researchers concluded.
Why is COVID-19 hitting some communities harder than others? And who exactly has been hit hardest? We're seeing this happen across the country. But to better understand the divide, we zeroed in on two New York City boroughs, the Bronx and Manhattan. Even though Manhattan has more people, the Bronx has more cases and more deaths. We wanted to understand the reasons for this gap, so we compared the boroughs based on 3 criteria. Why more people are getting infected, being hospitalized, and dying from COVID-19. And it's revealed this pandemic is attacking 2 very different Americas. Let's look at why there's a difference in infection numbers between the 2 boroughs. We'll start with income. The Bronx is the poorest borough in the city, with a median income of $38,000, compared to Manhattan's $82,000. Almost 60% of people in the Bronx are paying more than they can afford for housing, which has led to more multi-generational housing in the Bronx and more residents in public housing than any other borough. For every apartment in the Bronx, there are 2.8 people living in it. Compare that to the 2 people living in every apartment in Manhattan. More people at home likely means more people get sick. Overall, there's 350,000 more housing units in Manhattan than the Bronx, and better quality housing. See this map? Most residents in the Bronx are dealing with maintenance problems, like leaks, rats, cracks, plumbing, and broken toilets. These issues alone make it more challenging to live at home, not to mention having to work from home because of COVID-19. That is, if you can work from home. According to the U.S. Bureau of Labor Statistics, of those Americans making less than $33,000 a year, which are these neighborhoods in the Bronx, 9% of people could work from home. Whereas of those people making more than $79,000 a year, all of these neighborhoods in Manhattan, 60% could work from home. On the other hand, in the Bronx, residents who can't work from home are most likely out of a job and tight on money, or they're essential workers. Think grocery store clerks, transit employees, trash collectors, healthcare workers. Many of those people you see daily out on the front lines. 17% of frontline workers in New York City are coming from the Bronx, while just 12% are from Manhattan. And for the majority of these essential workers, getting to their job means taking the subway. Subway ridership has dropped across the city, but not by the same amount. In Manhattan, 75% fewer people are riding, but in the Bronx, ridership has dropped only 55%. So trains to and from the Bronx can be packed, especially with reduced subway services. Plus, people from the Bronx face longer commutes than people in Manhattan, on average 12.7 minutes longer, of standing body to body with that person who's maybe coughing. Okay, let's move on to the second criterion. Let's say someone in each borough does get the virus. What will influence whether they become hospitalized? The Bronx has had over 10,000 hospitalizations. Manhattan, about 6,000. Every year, New York counties are ranked based on their health. Last year, Manhattan was 6th best in the state. The Bronx, dead last, out of 62 counties. This is based on things like access to clinical care, the environment, and pre-existing conditions. The Bronx has higher rates of pre-existing conditions like asthma, heart disease, and obesity, conditions that increase the risk of a severe COVID-19 case. To explain why this is, we're going to have to go deep. We'll start with obesity rates between the two boroughs. Studies have shown that poor diets and lack of exercise are linked to obesity. And in the Bronx, families facing money problems or limited time are forced to turn to cheaper prepackaged foods. 87% of kids in the Bronx rely on free or reduced school lunches, which are packed with salt and fat. Plus, the Bronx has almost double the amount of food stamps per individual compared to Manhattan. But the greatest contributor to diet, though, is access. And the Bronx has historically had some of the worst food deserts in the country, where it's hard to find affordable and healthy food close to home. All of these factors have created a lack of healthy resources for generations in the Bronx. They lead to unhealthy eating habits and high rates of obesity and diabetes, both pre-existing conditions that increase your risk of death from COVID-19. On the other hand, in Manhattan, life expectancy and access to healthy food is much higher. People not only have more access to grocery stores, they also have more gyms to choose from. Simply put, these things and disposable income make it a lot easier to be healthier here. Another pre-existing condition that skyrockets risk of COVID-19 hospitalization: asthma. In big cities, studies have shown pollution is a major cause of asthma. Pollution is bad across New York City, but the Bronx has the highest rates of asthma-related emergency room visits. There's even a place nicknamed Asthma Alley in the South Bronx. It's surrounded by 4 highways and sanitation and sewage facilities. There's also a bunch of trucks coming and going from all of these distribution centers, these food wholesalers, and the Fresh Direct Distribution Center here, and the Wall Street Journal and New York Post printing press here. At last count, asthma hospitalizations were 27 times higher in this area than the rest of the city. Bad asthma equals a higher risk of being hospitalized with COVID-19 and needing a ventilator to help you breathe. But it gets worse when you take into account how accessible medical professionals are in these areas. In Manhattan, there's 1 physician for every 750 people. In the Bronx, there's 1 physician for every 1,770 people. There are also fewer hospital beds in the Bronx. Manhattan has almost double the amount of hospitals for only a 15% larger population. That brings us to our third and final criterion. Why are more people dying due to COVID-19 in the Bronx? In Manhattan, 4 emergency hospitals were constructed to combat coronavirus. While the Bronx was promised one, the borough hasn't gotten it yet. Quality care also isn't as accessible in the Bronx. On average, Manhattan hospitals received 3 out of 5 stars. Bronx hospitals received 1.2 out of 5 stars. Jacobi Hospital in the Bronx is one of the 5 worst-rated hospitals in the nation. Add in the effect of pre-existing conditions we talked about earlier, and the Bronx has had 2,800 deaths of people with underlying conditions. Manhattan, almost 1,300. Altogether, as of May 10th, Manhattan's death toll was 1,946, while the Bronx hit 3,177 deaths. And when you break down New York City's death toll, people of color are 2 times more likely to die of coronavirus. In the Bronx, the population is 85% Black or Hispanic, whereas in Manhattan, 64% of the population is white. This is why you're seeing headlines that a disproportionate number of people of color are dying of COVID-19. But these deaths go beyond coronavirus. For the Bronx, cycles of income inequality, food deserts, poor healthcare, fewer hospitals, and crumbling housing have harmed communities of color for generations. And we see this pattern repeat itself again and again, with Black and brown communities across the country: Baltimore, Detroit, Chicago, St. Louis, Los Angeles. This disease is not the great equalizer. Yes, anyone can get COVID-19, but not everyone is as vulnerable to dying from it. That has everything to do with the problems in place long before this ever started.
I want to compare the U.S. to Spain, because Spain is number 2 in the race for the most cases, which is not a race we want to win. They had 204,178 cases in Spain, 930,000 total tests. So we did 4 million, they did 930,000. They had a 22% of all COVID tests were positive in Spain. 22% of those tested were positive in Spain. Spain has 47 million people. So that equates to about 10 million cases. If we extrapolate the data as we've been doing with every state, gives us about 10 million cases. How many died in Spain? 21,282 out of 47 million. You have a 0.05 chance of dying from COVID as a citizen of Spain, and a 90% chance of recovery from COVID without being on a vent, without being in a hospital. I wanted to compare the U.S. to Spain because we have the most amount of cases globally. So I thought that was important. And then when you bring up a system of lockdown, you automatically have to compare it to a system of no lockdown. Sweden and Norway. I'm Norwegian.
Norway has lockdown.
Norway has lockdown. Sweden does not have lockdown. What happened in those 2 countries? Are they vastly different? Did Sweden have a massive outbreak of cases? Did Norway have nothing? Let's look at the numbers. Sweden has 15,322 cases of COVID. They did 74,600 tests, which is 21%, similar to the other countries. 21% of all those tested came out positive for COVID. What's the population of Sweden? About 10.4 million. So if we extrapolate out the data, about 2 million cases of COVID in Sweden. They did a little bit of social distancing. They would wear masks and separate. They went to schools, stores were open. They were almost about their normal daily life with a little bit of social distancing. They had how many deaths? 1,765. California's had 1,220 with isolation. No isolation, 1,765. We have more people. What I'm getting at is millions of cases, very small death. Millions of cases, very small death. This is what we're seeing everywhere. Norway, its next door neighbor. This is where I come from. These are 2 Scandinavian nations. We can compare them as they are similar. Let's look at the data. Norway, 7,191 cases of COVID. Total COVID tests, 145,279. So they came up with 4.9% of all COVID tests were positive in Norway. Population of Norway, 5.4 million. So if we extrapolate the data as we've been doing, which is the best we can do at this point, they have about 1.3 million cases. Now their deaths as a total number were 182, fairly small, but statistically insignificant from 1,700, you realize. Millions of cases, small amount of deaths. 1,700, 100, these are statistically insignificant. So you have a 0.003 chance of death as a citizen of Norway and a 97% recovery. Their numbers are a little bit better. Does it necessitate shutdown, loss of jobs, destruction of the oil company, furloughing doctors? We have both been in the ER through swine flu and through bird flu. Did we shut down for those? Were they much less dangerous than COVID? Is the flu less dangerous than COVID? Let's look at the death rates. No, it's not. They're similar in prevalence and in death rates. So from what we're seeing right now, it's time to open back up. The science says it is. The models we have been using from predictions to predict the amount of disease are not accurate. This information is accurate. It models the flu. Let's go back to work. That's what the data is saying. Not models. Data is saying that. I think we need to open up the schools, start getting kids back to the immune system. And the major events, the sporting events, these are non-essential. Let's get back to those slowly. Let's start with schools. Let's start with Cafe Rio and the pizza place here, because I can go into Sully's right now, which I did this morning. There was 25 people in there, and I can stand in line for 10 minutes, but I can't go in Cafe Rio and sit there for 10 minutes. Does that make sense to you guys? And I can go into Costco and I can shop with people, and there's probably a couple hundred people, but I can't go in Cafe Rio. So big businesses are open, little businesses are not. There's no science behind that. As we've gone over, that is not science. There's other factors in play that we don't have time to go into, but it's not science. I want to make that clear.
But at the same time, you said earlier that doctors are feeling pressure from hospital administrations to put COVID down as a reason of death, which would presumably instill more fear in people. Doesn't that go against that whole line of thought? Why would they do that if it was going to cause more fear and cause them to lose more money?
Exactly. There's something else going on. And that's a different discussion.
We don't know. I mean, we're just here to present the scientific facts.
That's a political discussion.
Yeah. So you think some hospital administrators are undercutting their own bottom line?
We're presenting the medical data here.
Hydroxychloroquine is not a controversial drug. I know that your listeners will find that hard to believe because all they've heard about it is controversy. It's not a controversial drug. It's been FDA approved for 65 years. We give it to pregnant women. We give it to breastfeeding women. There are patients who take it for decades. In fact, the typical use of Plaquenil or hydroxychloroquine is for decades. This is not a controversial drug. And it wasn't controversial to me until the day after the president said it and the press went very ballistic over it. I really can't understand it to this day.
The experts are wrong. Hydroxychloroquine, when used early and combined with zinc, is an effective treatment, and that's why thousands and thousands of physicians around the country and around the world are using it and taking it themselves.
I don't love to talk about hydroxychloroquine so much because it's become such a political hot potato. But one of the reasons, or maybe the main reason I started down this path, was the resistance I got when I prescribed hydroxychloroquine. Now, for me as a doctor, I'm there really only for the patient. It's not a two-way street. I am there for the patient. So when I had to prescribe hydroxychloroquine to a couple of patients, I did it. And the next day, I got tremendous pushback. I was stunned. What's really disturbing about this, we got a letter, every California physician got a letter from the California State Medical Board essentially threatening us if we prescribe this medicine. It's very carefully worded. I'm happy to send you an email copy. But it says we have to be cautious about prescribing this. It could be construed as unprofessional conduct. That's enough to stop a doctor from being honest and truthful with the patient about what they need.
COVID-19 is a PSYOP, a psychological operation.
So do you remember when it first started, they're like, yeah, masks don't really save you. They're not going to help you. But, you could wear one because then you won't infect someone else. It'll keep that. But then you heard reports that, well, if you do wear that, it'll make it worse for you to wear it. It's actually, so you couldn't, and a regular person doesn't know which way to turn. So they turn to this guy, and it turns out this guy was lying. He was told, I'm going to play it for you what he said. Here's what he says. Because they were first telling people that masks don't help you. Well, now the evidence is in that the countries who wore masks, it did help them. And here's what he says.
To your first question, which was, what about a month or so or 2 or 3 ago when people were saying you don't really need to wear a mask? Well, the reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way to take care of people who were infected with the coronavirus and the danger of them getting infected, we did not want them to be without the equipment that they needed. So there was not enthusiasm about going out and everybody buying a mask or getting a mask. We were afraid that that would deter away from the people who really needed it.
So what he's telling you is that he's a liar and that he lied to Americans about the coronavirus on purpose so that you would be less safe from it. Because he had what he believed was a higher purpose, which was to endanger your life and give you false information so that he could save someone else's life. And lying to you was the way he could facilitate that. So now you'll never have confidence in the government. When they tell you, or him, I'll never believe another thing that guy says. Will you? And if you do, now who's a sucker? This is crazy. I mean, what this actually makes me the most angry at is journalism. And because they're not even going to cover this. I saw Kyle Klinsky cover this as I was coming right before on air. I watched his coverage of this. Who else covered this? Have you seen anyone else cover this? I don't know. Let me Google. Let's see. Again, it'll be one of those things where they cover it, but like in passing. It'll be a sin by the lack of emphasis. Let me look Fauci lied. Let's see what comes up if I Google Fauci lied. The Hill. Fauci says Americans are ignoring science amid the corona. That's 1 day ago. This is amazing. Business Insider. Fauci mask advice was because of doctor shortages from the start. So I got the Business Insider and the Hill. Let's see what else. Gizmodo. Gizmodo has it. Let's see. Washington Examiner has it, but it's weird. I don't see NBC News, New York Times, Washington Post. And so here's the National Geographic. Here's a headline from the National Geographic. It says, no scientific evidence the coronavirus was made in a Chinese lab, says Fauci. Well, now how do I know that's true? I bet he's lying. How do you know he's not lying about that? How do you know that Fauci doesn't know for sure the opposite is true?
Hello, I'm Bill Gates, chairman of Microsoft. In this video, you're going to see the future.
Who is Bill Gates? A software developer? A businessman? A philanthropist? A global health expert? This question, once merely academic, is becoming a very real question for those who are beginning to realize that Gates' unimaginable wealth has been used to gain control over every corner of the fields of public health, medical research, and vaccine development. And now that we are presented with the very problem that Gates has been talking about for years, we will soon find that this software developer with no medical training is going to leverage that wealth into control over the fates of billions of people.
Because until we get almost everybody vaccinated globally, we still won't be fully back to normal.
Bill Gates is no public health expert. He is not a doctor, an epidemiologist, or an infectious disease researcher. Yet somehow, he has become a central figure in the lives of billions of people, presuming to dictate the medical actions that will be required for the world to go back to normal.
Look at this article. It says Bill Gates and America's millionaires are building underground survival bunkers. Here's another one. How scared should I be a contagious disease will wipe out humanity? Here's another one. Billionaires are preparing for the apocalypse. Do they know something you don't know? Another one. Bill Gates fears plague that could wipe out humanity. Here's another one. Bill Gates thinks a coming disease could wipe out or could kill 30 million people within 6 months and says we should prepare for it as we do war.
We budget a lot of money, have a lot of people who think about nuclear deterrence, and I'm very glad that work's being done, and I rate the chance of a nuclear war in my lifetime as being fairly low. I rate the chance of a widespread epidemic far worse than Ebola in my lifetime is well over 50%.
Anthony Fauci, meanwhile, has become the face of the U.S. government's coronavirus response, echoing Bill Gates' assertion that the country will not get back to normal until a good vaccine can be found to ensure the public's safety.
If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now.
Beyond just their frequent collaborations and cooperation in the past, Fauci has direct ties to Gates' projects and funding. In 2010, he was appointed to the Leadership Council of the Gates-founded Decade of Vaccines project to implement a global vaccine action plan, a project to which Gates committed $10 billion of funding. And in October of last year, just as the current pandemic was beginning, the Gates Foundation announced a $100 million contribution to the National Institute of Health to help, among other programs, Fauci's National Institute of Allergy and Infectious Diseases research into HIV. Also in October of last year, the Bill and Melinda Gates Foundation partnered with the World Economic Forum and the Johns Hopkins Center for Health Security to stage Event 201, a tabletop exercise gauging the economic and societal impact of a globally spreading coronavirus pandemic.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
Governments need to be willing to do things that are out of their historical perspective, or for the most part, it's really a war footing that we need to be on.
And here's the thing. No one can blame anyone for a global pandemic.
Are you sure about that? Where we go one, we go all. The world is about to change.